Mac, thanks so much for staying with us. The month of May is Stroke Awareness Month, and while strokes can be a common occurrence, there are ways to spot the signs quickly and also ways to lower your risk of having one.
Certainly, and here to share more with us about that is Dr. Cheryl Bushnell. She is a neurologist at Atrium Health Wake Forest Baptist. Good morning, Dr. Bushnell. Thanks for being with us today.
Good morning, and thank you for having me.
Absolutely. Helping to get the word out, of course. I know, I think over the years, a lot of people associate strokes with people who are getting a little bit more in advanced age, but that's not necessarily the case. What kind of signs are we looking for that might indicate a stroke?
Well, one of the easiest ways to identify a stroke is to use a really simple acronym, and we use BFAST. And so the B stands for balance loss, if the person is having trouble with their coordination or walking. E is for eyes, if they're having blurred or double vision. F is for face drooping. Does one side of the face droop or is it numb? You can ask a person to smile and see if it's uneven. The A stands for arm weakness. If one arm is weak or numb, you can ask the patient to raise both arms, and does one arm either not lift at all or just drift downward as a sign of weakness. S stands for speech difficulty. Is their speech slurred? Are they having trouble finding words or understanding? And then T is time, and that is time to call 911 or time since the last time the patient was normal. And that's a really important piece of information that we need for determining treatment. So yes, BFAST is an excellent way to remember what a stroke symptom is.
And what about any significant differences in symptoms for men versus women, as well as age?
So there are sex differences in stroke symptoms, but the major stroke symptoms are really the same in both men and women. The only thing that really is different is that women may have some non-traditional types of stroke symptoms, like severe headache or unconscious state or pain or more confusion. So some of the symptoms in women just may muddy the picture a little bit, but it's still a stroke, and if it's sudden onset, it's still important to pay attention to those symptoms.
All right, Dr. Bush. Go ahead, I'm sorry. Go ahead.
As far as age is concerned, yes, it is more common in people as they get older, but young people can have strokes too, even babies.
Oh, wow.
So it's really good to know to be aware of the BFAST and how to keep an eye on potential symptoms that may pop up. Dr. Bushnell, what are common treatment options?
Well, a lot of the treatments are done early, and that's why it's so important to understand when the patient is normal and to call 911. The stroke is caused by a blood clot in the brain, and treatment is based on time and is sensitive to time because time is brain. And so we have clot-busting medications and surgical techniques to remove blood clots that can prevent long-term damage from the stroke. But we have a short time window. So for medical treatment through an IV, the clot-busting medication generally has to be given within 4.5 hours. For other patients who might be candidates for surgical removal of the clot, they might be up to 24 hours. So those are some of the treatment options that we have today. And these treatments have really revolutionized stroke care.
Well, if we could quickly touch on tips for prevention before we say goodbye, please.
Absolutely. Some of the major risk factors are high blood pressure, high cholesterol, and smoking. They can all be modified, and you can work with your doctor to address these issues. Other important things to remember are staying active, not sitting too much during the day, exercising, and eating healthy. All of those things can help lower risks.
Great reminders, Dr. Bushnell. Thank you for your time. Viewers at home, you can learn more about Stroke Awareness Month on the Atrium Health website. We will also have this interview posted on triadcw.com later.